Hey everyone, it's Michael here at Home Health Success Academy, and in this video what we're going to be talking about is KPI. That's right, 3 letters, KPI. Let me ask this question. What are your KPIs for your organization? Now, if you don't know what KPI means, you need to know, because you need to know what the KPIs are of your potential referral sources. KPI stands for Key Performance Indicator. These are things that a company, a potential referral source, values and is looking for from a company that they actually want to work with. And it differentiates from one type of organizations to another. So if a physician or anybody that's going to want to refer a home health patient, a home care patient, or even hospice patient to your agency, there's a variety of KPIs that they're going to require. And each company is different. Each company may be different, plus each person within the company has their own KPIs as well for them to be able to make a decision on what company to choose to call to be able to refer that patient. So, for example, typical KPIs that most companies want is number one, fast service. Meaning, when they call you, they want to make sure that they get a call back. Now, here's a funny thing. I've done this so many times. I've actually done this in front of owners of facilities, owners of home health and home care companies, where I will grab the phone and I will actually call their office and no one will actually pick up, right? And so no one picks up. I leave a message and nobody calls back right away. Right? So either the front desk person is busy in another call, either the front desk person is out of the office doing something in a quick smoke break, coffee break, snack break, whatever, chit-chatting with someone, or because I'm in a meeting with a owner, an administrator of a home care company, and they're the only one in the facility, no one's answering the phone call, right? So sometimes it's fast service. It's how can somebody actually pick up the call right away. That's a key performance indicator, right? If you have to make a phone call, let's say you needed something really bad, a service, and you call the company and you got a voicemail, you left a message. What are you going to do? You're going to call the next person in the list, because what you want is fast service. For example, Uber, right? Uber came into this industry not to become a taxi company, but to be a company that is able to save you time. Because before, you would have to hopefully see a cab, hail a cab, and have them, pick you up, right? And a lot of people were saying, well, that's a waste of my time. Let me just stay and enjoy my cup of coffee, stay and enjoy my glass of wine, or walk out. It's saving time. And so a lot of companies, like I said, value time. They want fast service. They want somebody who's going to be able to pick up right away. And let's take the whole thing out about the way the person answers a phone call, if they're professional, if they know how to be able to, onboard a patient. Just fast service is important, and quick return calls is very important, and it's one of the most important KPIs. So how to be able to handle that? Well, one thing is this. Make sure you have a policy that if the phone rings in your office, that you pick up within 3 rings. Anybody in the office should be able to pick up the call. Just because you have a receptionist, that does not mean that your QA, your DON, your supervisor, your janitor, if you have one, should not pick up the phone call. Number 2 you can do is have an answering service. You can actually hire an answering service so that if the phone rings more than 5 times, it will ring with them so that they can actually pick it up. Or you can set it up after 3 rings in your company, it automatically transfers to them. This allows you guys to be able to make sure that you can take all the phone calls and you're not missing anything, right? So like myself, in my companies, in the companies I work with, we actually hired a separate company, an outside company, and outsourced that, making sure that all phone calls are answered 24 hours a day. It's very important to be able to have that. We even have an assigned number in our offices, in the home health agencies that I've owned, and we have an assigned number that is actually given to, we call it, it's pretty much the nuclear number, right? Meaning that this is the number given to our B categories and our C category home health agencies or referral sources. And the reason why we do that is because we want them to have a direct contact. And if that line rings, has to be answered within 2 rings. Reason for that is we know that they are a current referral source and we need to nurture them because only they have access to that number. No staff member has access to that number, no family members, no one. It's referral source number. And if that line rings, everyone in the team knows that they need to answer that particular number as soon as possible and take care of that. So that's one thing. Number 2 thing is the admission process. A lot of home health agencies will say, well, our admission, when we get a referral, it takes between 24 to 48 hours to be able to admit a patient. That right there is so 1990s and 1980s. If that still is your policy, it's okay to have that policy, but here's the thing. You need to make sure you deliver more, because why? Every other home health agency will say that we will admit the patient within 48 hours. But guess what? If it takes you 48 hours to visit that patient, that first 48 hours is where the highly likelihood that a patient ends up back in the hospital and you lose that referral and you look bad. Your agency should have a 12-hour window to admit a patient. And if you're telling me that is impossible, then you shouldn't really be in this business. And I'm not trying to be blunt here, but you have an office manager, supposedly. You should have a supervisor, a QA nurse on board, a DON. One of those people can actually admit a patient. This is when, you have to make everything happen. That patient is just about to pay someone's salary. That patient, let's say for example, you have a medical home health agency, you can bill Medicare. You're about to get $4,000 from that patient. After you provide all the services, that takes care of 1 month's salary of someone. Okay, so you have to understand right there and then that patient is money. And if you're willing to wait 2 days to get paid that money, then you're not putting value on that particular client, on that money. And that's how we make money in our company. The reason why we're able to employ people is because we are able to bring in money for the company. And you have to understand that. You have to put value on that. Okay? So making sure should be the standard. You should have the policy, because once an order is made after 48 hours, if you're a medical, you have to get a new order. And you don't want to have that because that's just too much work. And also makes you look bad. So if you know a patient's being discharged, meet the patient at home. And if you don't even need to have a nurse admit the patient, just have someone meet the patient at their house. Why? Because you can start seeing, clearing the room, making sure it's a safe place, make sure the medications are there, making sure that the DMEs, the durable medical equipment, it arrived to the patient. Make sure that they have oxygen, because if they have discharge orders for O2 and they don't have O2 at home, guess what? That patient's going to be having SOB, shortness of breath, and ending up back in the hospital, and you lost that, and you look stupid in front of the hospitals, you look stupid in front of the people that referred you, the doctor, the nursing home, and right there alone, you can all of a sudden lose a referral source. I use the word stupid because it's stupid. It really is. I have to be honest. I don't want to put any filters, because we don't want to lose patients. A patient that we lose potentially could be more patients that we lose because we may lose the referral source and their trust. Okay, so that's one thing that you need. That's a key KPI, key performance indicator, that a lot of these referral sources are looking for. Number 3, right? Your admission rates, your hospitalization rates. What is it? They want to make sure they work with agencies that can keep the patient at home and not going back to the hospital, right? So that's one thing that a lot of hospitals and SNF units are looking to, right? So they're looking at your star rating if you're a Medicare approved home health agency, because that shows the information, how you're doing and what you're doing. Another thing is this: if you're not aware, there's a study made by Medicare and they said that the patient who has congestive heart failure is highly likely, there's a higher percentage chance that they end up back in the hospital when they get sent to a home health agency. So what does that say about us in general? There's a lot of home health agencies with great heart failure programs. There's a lot of agencies with heart failure programs, but they don't act on it, and the team is not trained on it. And even the marketers can't even fully explain what it's all about. These are things that you guys have to have, right? So another thing is, how can you get them compliant? Well, take their medications. If they skip a couple days of Lasix, these CHF patients back in the hospital. I've used a company called Medicare. It's a medication reminder program. I believe it's called medicationreminderprogram.com is the company. And what they do is they actually call the patient on a daily basis for us at certain times that we choose to remind the patient to take their medications. Because in non-medical or even medical, we're not there 24/7 with the patient always. And so we need to be able to have a lot of resources in the company that allows us to be able to make sure that the patient takes their medications and stays home. If you're a non-medical, okay, how can you make sure that your referral sources are happy? Right? So what are the things that they're looking for? Same exact thing as medical as well. They want good service, fast service, right? Once they pass the patient onward to you, to your agency, they want you to be able to take care of it from the moment you get that referral and remove that stuff or the responsibility from them, but still having that communication. So taking it to the next thing, another big KPI, key performance indicators that a lot of companies look into before they start working with other agencies like yours, hopefully, is also communication, right? A lot of people will have your physician portal in your software, your CRM that you're using, yet you don't really offer it as a marketing tool to physicians. But guess what? Just because your software that you're using has a physician portals, a lot of physicians don't want another portal. They don't want another sign-in place where they have to sign in, remember the password in order to be able to transfer some information. So are there things that you can do to increase your communication factors, right? One thing that we like to use is using either Viber or WhatsApp, right? Viber or WhatsApp, because those are encrypted messaging applications in your phone rather than something that is not, such as the regular iMessenger for your iPhones. So it's encrypted. So you can use that because one thing you need to do is to be able to protect HIPAA policies. There's also a couple software apps out there or newer app companies that is strictly HIPAA compliant and strictly for the medical field, and that's something that you can look into.